When you were first starting doing your research and you're finding, it sounds like articles and books and things back in the early 1900s,
Yep.
what did those resources look like? And what was the information that you found in those sorts of things versus, where the trend of nutritional medicine is today?
Well, they didn't know much about vitamins and minerals back then. The biochemistry was still in its infancy. A lot of it was dietary stuff. There was a lot of treatment with hydrochloric acid. As a matter of fact, I recently worked with somebody who had persistent diarrhea for 3 months, and her medical doctor had worked her up and not found a cause. And so she was just told to take antidiarrheal medications. She's in her 70s. So in interviewing her, I discovered that the symptoms began after an acute bout of gastroenteritis. And from my awareness of the literature, there was a study back 30 or 40 years ago that said there's post-infectious hypochlorhydria, low stomach acid, and it can last months. It usually goes away, but it can last for a long time. And we know from the old literature that, as a matter of fact, there was a study from 1902
Wow.
that hypochlorhydria can cause persistent diarrhea. So I asked her about other symptoms of hypochlorhydria, bloating after meals, inability to eat a large meal. It all fit, and it all started at the same time. I said, okay, well, I'm not much for lab testing unless it's really going to change your therapy, and it's not something you could have figured out or guessed in the first place. So we didn't do a gastric analysis. I said, try low-dose hydrochloric acid with your meals, and boom, cure it immediately. But that was from 1902.
That's incredible. Wow.
Yeah.